I am 56 years old. I came to Dr. O because I had congenital defects in my spine. It took me by surprise because I've always been active. I did the nerve block, I did the cortisone shots, nothing was working, physical therapy. So they referred me to Dr. O, and he said, oh, we're gonna operate on you and take care of you, and he did that.
They have 17 turnovers, you have only 7, and you're out rebounding them by 7, 24/7 as well. Back to James, over to Diaz. Diaz fakes, puts up the 3, and knocks it home.
Well, I work for Verizon. I am an installer technician. I'm also an athlete. I played football for over 20 years. I also coach now. I've won multiple national championships. I've also had an opportunity to try out for NFL Europe.
If he's joking about these national championships, look at these rings. Oh my goodness. Tell me a little bit about what was going on with your vocal cords and perhaps the injury that you were noticing.
So, it's 1 December, I just woke up one morning and I had this shooting pain in my neck and it was shooting down my arm. So I made an appointment with a neurologist. She did the nerve test, said you have something going on in your vertebrae. So that's when she did the nerve block. That worked for like 2 weeks, and after 2 weeks, the pain came right back. And then I did the cortisone shots. And what really was very alarming was I lost all strength in my right arm, and I'm right-handed. So when you lose strength in your dominant hand, it throws you for a loop. Very first time we sat down with Dr. O, very open-minded, very forthcoming with information about what it was going to take, what it involved, how it's going to be, what the recovery line was going to be like. And it put me at ease. So once I was at ease and he, walked me through what the process was, he said, okay, we're gonna do a nerve, not a nerve, he's gonna do a fusion. We're gonna fuse verse 3 to 7. And, you're gonna be immobilized for a couple of months. I didn't know what that was going to entail, but walking through that whole process beforehand, before having the surgery, gave me a sense of comfort and peace. So when I went through the surgery and I came out, I already was prepared to what it was going to be, but not prepared for the actual, going through it process. You have to not allow yourself to the worst case scenario, because when you hear spine, you're paralysis or, you always think the dark stuff. The staff at Lenox Hill was very professional, very open-minded, very warm, and, gave me a sense of comfort and peace knowing that I'm in good hands. And Dr. O was a very excellent surgeon. He was referred to, so I was like, okay, we're gonna do this.
What was it about Dr. Okubadejo that made you feel like he was the right guy for the job?
His demeanor, his openness and honesty about what he was going to do, why he's doing it, what it was going to entail, why it was going to entail, what the recovery, when I say he was meticulous about every single step of the way, he was very meticulous, and he answered every single question I had. He didn't hold anything back, and he's a very open and hospitable guy. So it was very comforting to know that, one, he's from the same neighborhood I was in. We both come from Canarsie, Brooklyn. And at the time of the surgery, his father was just getting ready to celebrate his 80th birthday. So it was all good, having fun, laughing and joking. And that's why I was comfortable with him doing the surgery. Obviously, I did my research, once I looked him up. First, I had to learn how to pronounce his name. Right. When I came out of surgery in the recovery room, the first thing you notice is the lack of movement, obviously, because you can't move. Anesthesia's getting ready to wear off. You're gonna have some pain, some discomfort. The nurse here has the painkillers for you, and we'll take care of everything is good. He came like maybe an hour after I was in the recovery room, said, how are you feeling? Everything's good. And then again, he walked me through what the process was. Says, this is how you're gonna feel. If this happens, please let me know. These are the drawbacks, these are side effects to the medication, blah, blah, blah. Thank goodness I didn't need to take a lot of the medication, so that was great, because, you always hear about opioids and stuff like that being highly addictive. So I was very leery of that. Thankfully, I didn't need a whole lot of it, so I was good on that part. And then it was just the process of going through the recovery. He said, for the first 2 weeks, you're gonna lose your voice. For the first 2 weeks, really, I had to whisper. So I wanted to use my voice, but I can't use my voice. My wife could stop talking. You're raising your voice too much. Stop. So that was one of the things. Then it was the cold pack that I had to put around my neck. So I had to take the brace off, put the cold pack, and I had to do that 6 hours a day. So that was getting used to that, because I was very leery of taking the brace off and not moving, because he said you can't look down, you can't turn to the left, can't turn to the right, don't look up, So I'm like, okay, so when you take the brace off, it's like, I don't want to do anything. So thankfully my wife was home with me and she helped me to, put all the apparatus on and stuff. And when I say it was cold, oh my gosh, it was cold. But not having a lot of pain helped with that. And then slowly after the first month, I was able to take the brace off, and he gave me a soft brace, soft collar. And the best news he gave me was, hey, you can go back to coaching. Because I couldn't coach, I couldn't announce, couldn't do anything. He said, you can go back to coaching, but I want you to take it easy. I know you're very passionate about what you do, but take it easy, don't push yourself. So I had 10%, 10-degree turn to the left, and like 20% turn to the right after my first evaluation for physical therapy. And when I say the hardest thing is to break that initial pain to actually move, because you feel the pain and you automatically don't want to go anymore. But if listen, in order for you to do this, the longer you take to move, the less mobility you're gonna have. So you have to get used to pushing the envelope a little bit, not too much, but to the point where I see progress. And that was the hardest thing. It's four stages of recovery in physical therapy. So the first stage is supposed to take about 2 months, and the second stage, another 2 months, third stage, a month, and that's how we mapped it out. But it took me so long to get out of that first stage because it was a mental block. Because I'd go home, I'd do the exercises, but at home, I'm not pushing myself like the physical therapist is gonna push me, because he knows what I need to do. At home, I'm gonna limit myself because I don't wanna push the envelope. So it took about 2.5 months to get out of that first stage. And once I got out of that first stage and I saw and felt the more mobility, I'm like, I can do this. Then the athlete in me kicks up, like, you know what? This is not gonna stop me. You want a surgeon to put you at ease, especially when it comes to major surgery. Dr. O fit the bill, A+, 100%, gold star, whatever accolades you want to give him, I give him, because it was perfect, absolutely perfect.
That's wonderful. What would you say to anyone else who may be considering surgery, about to have surgery, and who is fearful and concerned with what life is going to be like on the other side?
Number one, have faith. Do your research on the surgeon. If it's Dr. O, yeah, do your research, but I'm telling you right now, Dr. O is the man for the job. Second, trust yourself. Yes, it's gonna be scary. Yes, there's gonna be limitations, but know that if you don't do it, what your life will be, and if you do it and press through, what your life can be. And then, while you're going through it, stay positive. Even if you're in pain and even if things are not going the way you wanted to go, stay positive, because I'm a firm believer that you speak things into existence. So if you say it, you can do it.
Let's talk about Patrick, the gospel singer and sports broadcaster.
So Patrick is a great gospel singer, a great broadcaster. I've seen some of his work, amazing. A lot of people who use their voices for their work are concerned when it comes to having neck surgery. There's a nerve called the recurrent laryngeal nerve. And whenever we're doing neck surgery, there's always a chance that that nerve can get stretched and people could have some potential issues. So I make that clear before they have the surgery. The odds of that are very low, but patients who use their voices for their careers are very concerned about that, so I have to really reassure them. Patrick had 3 levels of impingement in his neck, so he needed a 3-level decompression. So he had done the physical therapy like everyone else, he had done the injections, nothing else was working, he had horrible pain in his neck, going down into his arm, so he absolutely needed the surgery. So I did a 3-level ACDF, anterior cervical discectomy fusion. With that procedure, I usually use a microscope. I make a cut on the left side of the neck. It's a blunt dissection to get down to the neck. Removed the 3 herniated discs. Did a beautiful fusion on him. That procedure typically takes about 2 hours, 2.5 hours. Most patients are in the hospital for about 1 or 2 days. Patrick did great in his hospital stay. He sent me a video about 3 months after surgery, and he was in choir singing, and it was phenomenal. And he sent me a bunch of videos of him broadcasting games, which is phenomenal. Like I've emphasized, the key is really education. Like the odds of things going wrong are very low. But patients just need to understand exactly what they're getting into, have a good sense of expectation. And as long as you get them feeling comfortable and they feel like they're a partner in the decision-making, we often get the outcomes that we're looking for. And Patrick was a shining example of that.